we're very nervous about this interview, actually, because we don't know what information you may or may not have. So good morning to you, sir.
And good morning.
Any test results overnight that show you anything, paint a picture about anything?
Well, a lot of test results came in through the evening, and they're all negative, so that paints a good picture at the moment. I do a late night check of my cell phone, and first thing in the morning, just if there's any positive results, we get a heads up straight away. So far so good, but as you were saying in the intro, really it's those results that come in from testing through the late part of yesterday, through today and into tomorrow that are really important.
No, but a great sign though, isn't it, Dr. Rifford? I mean, it's a great early signal and sign that, man, we might have dodged the first bullet, but dodged the second one.
Yeah. Well, as long as the right people are getting tested and that people with symptoms are staying home and getting tested as well. We did see, a lot of tests yesterday. We'll have the exact number through shortly. And great to see people doing what was asked of them. And just to this point about, how quick we were at getting the information out and some criticism of that. Just to remind people, this isn't a sausage factory here. One of our public health colleagues in the Regional Public Health Office was up most of the night on Tuesday, actually assessing each of these locations to see what the level of risk is. It was very important that we asked people to do the right thing. For some, we've got hundreds of people we're asking to actually isolate for 14 days, be tested 2 or 3 times. That's quite a disruption to their lives. So we do have to get it right, remembering that the person was here over the weekend. We got the result through Tuesday evening, and within 12 hours we'd done all that work and had that information out there. And it's great to see the response that has come from Wellingtonians.
Did you consider? Was there any consideration of a late night media conference to go public and to at least tell Wellingtonians, hey, you may want to think about not going to work in the morning, because by doing it the way you did it, it still allowed people to go to work and the cafes to open up and all sorts of things when you knew that there was an issue there.
Well, just to be clear, we didn't really get the information till mid-evening on Tuesday. At that time, our Australian colleagues were interviewing the case. Once they had finished, our team at Regional Public Health had stayed up and they did the full case interview. That takes at least an hour. They have to get all the information. The person had used the app, so that was helpful as well to look at where they had been. But then there is this process of doing the risk assessment. So there wasn't any indication to do a late-night media stand-up. We did, of course, send out a media release just after 6 on the Tuesday morning, and then those places of interest and a pretty long list, and many hundreds of people, if not thousands, actually caught up in that. And as I say, great that they have responded and are isolating and testing.
And excellent. That is excellent. But I'm just wondering if on Tuesday night there couldn't have been some sort of all points bulletin go out to say we could have an outbreak in Wellington. We're not sure yet, but we could have. So our advice at this stage. Then why wasn't it backed up with that kind of approach?
Well, it's it's not necessarily helpful for us to go out to people and say we had a case in Wellington, but don't panic. Just see if you can get some sleep overnight, and we'll let you know in the morning. I think we went about it in a measured, responsible way, and as I say, people have responded really well. That's the important thing, and I just want to encourage people to keep doing what's being asked of them, especially Wellingtonians over the weekend. We're in alert level 2. Use the masks in public transport and other places where you can't distance. If you're unwell, do get that test and keep using the app. It's incredibly helpful.
No, it really is. Any new locations of interest that you need to tell us about?
No new locations of interest. We keep getting perhaps more refined information about some of them, particularly the airport visit at Wellington when the person was on their way out. But all the up-to-date information is on our website with really clear instructions for people about what to do if they were at those locations of interest at the specified time.
Delta variant, do we have any more information on what sort of COVID it is?
Yeah, surprisingly we don't, because we know our Australian colleagues are really quick at turning around whole genome sequencing. What I was told yesterday afternoon was actually the people who run their genome sequencing lab are unwell, not with COVID, so they are behind on their sequencing. Look, there's every indication it's come from that Sydney outbreak, and therefore it will be the Delta variant. Our actions are the same, and it's been great to see people respond accordingly.
Just getting ahead of ourselves a little bit, if we continue to turn in negative tests, is it a little sort of shot in the arm, so to speak, for the vaccination? Because I had heard this guy had one injection, and therefore it would suggest that even one injection makes it more difficult to pass this thing on.
Yeah, look, the evidence is still emerging around whether vaccination reduces transmission of the virus even if people do get infected. I think that evidence is accumulating quite quickly that it does. We had a couple of cases here. We had a cleaner from one of our planes who had been vaccinated, I think with at least one dose of Pfizer. She didn't pass it on to any family members, and we've seen that in this instance where, this case that came here spent the whole weekend with wife and two close friends. All of them so far have tested negative. So I think this is encouraging, and it is one of the things we would expect from these vaccines, that not only do they protect people from getting infected, if they do get infected, from developing severe disease, but they stop them transmitting the virus onto others. That's great.
Ashley, has there been any update on how this Australian man is doing, how he's feeling, where he's at with sickness, and also mentally, because it's a lot to take on what's actually happened to him and the fallout from this country?
Yeah, look, I don't have any information other than that he's been incredibly helpful and, obviously cooperative. I can imagine how he'd be feeling because, the impact of just one case is like this is significant on businesses here. I mean, there are a whole lot of people who'd been training for months to run the Wellington Marathon, I think, that was on this weekend. So it is disruptive, and yeah, it is tough for people when these things happen. I hope he's doing fine. The fact that he's back in Australia is neither here nor there. He could be here, and I think anyone who gets this diagnosis of being a COVID-19 case, it must be a huge news for them to process because, it really does disrupt not just their lives, but the lives of those around them and often whole communities and cities.
Given what you said just before, Ashley, around the vaccine having some impact already in regards to passing it on, and so it hasn't been passed on at this stage in this case of Wellington, which to me looks like we may well have dodged a bullet, and let's hope so. I'm trying to encourage this whole thought that we might have dodged the bullet because it'll be great news. This vaccine shows how crucial it is to get it out there as quickly as possible now, isn't it? Because this is the sort of thing that's going to protect us not only from this sort of thing, but it gives us a passport to life and a passport to go head overseas and a passport to get on with it.
Yeah, look, I think it hugely reinforces the importance of people being vaccinated, and so it's been great to see that ongoing increase in intention to be vaccinated. We're obviously rolling out the vaccine we have as fast as possible. We're still ahead of this, what we had planned to do. The supply up until July had always been our constraint, so actually the rollout is going faster than was planned. But now, when that bigger supply starts to arrive through July and into August, September, we've got to scale up really quickly, and I'm really encouraged by the level of interest there is. And I think, again, as you say, this is a reminder of just how important vaccination will be to protect individuals and communities and our way of life.
You're urging people to get vaccinated. You're urging those who are doubting it to do the right thing, aren't you?
Well, what we can say is that we've got a program based on a vaccine that's very effective, the Pfizer vaccine, relatively, and it's got a really good safety profile, and we're seeing a strong level of interest in New Zealand. And this example from Australia does show that the vaccine, in this case, it seems like the vaccine is playing a protective effect in terms of reducing transmission as well. So huge benefits all round.
Final question, do you think we may have dodged a bullet here in Wellington?
Well, I'm hoping we have. I think Michael Baker described it on the first morning as a bit of a knife edge. The person had been out and about a lot, been in some quite crowded places, and obviously that's where we know there can be a risk. If someone is a spreader, you can get quite a lot of spread in those places. So far, so good. We'll all be watching, of course, with interest, but in the meantime, Wellingtonians and others around New Zealand who were in Wellington, just keep doing the right thing, and I'm sure we'll get through this.
Yeah, good people in Wellington, I'm sure they will. Good stuff. Ashley, I appreciate your time. Director General of Health, Dr. Ashley Bloomfield.